lot of questions from women who can't experience an orgasm, even using an enhancement or even through foreplay. What are some of the suggestions that can help them accomplish this? What's going on?
Okay, so I think we're going to the meat of the matter here when we talk about the clitoris. And so there is such a thing as primary anorgasmia, and Cheryl can talk about that. That's a diagnosis where you've never had an orgasm. And then there's the secondary anorgasmia where you've had orgasms in the past, but you're no longer having them. So while Cheryl was talking about the biopsycho, more psychosocial, I'm going to focus more on the bio part and on the anatomy and physiology of the sexual response, because I think that people need to understand all of the intricate nerves, muscles, glands that are necessary. And I'm going to credit my colleague, Dr. Christine Vaccaro, for this clitoris that she gave me last year at the national meeting. And I believe that you had some golden ones that were gifts too. I still think we need to give out these golden clitoris awards. But the issue with the clitoris is that it's not just a little button, you know? It is actually a full organ that has 3 parts, and look how nice and 3-dimensional we are here. With the clitoris glands, that's the little tip. That's what people think, you know, that is the clitoris, but no, there's more. There is a body that is very long, and there are legs on either side of the vaginal opening. And ladies and gentlemen, do you know that with arousal and engorgement and the appropriate sexual stimulation, this little complex thing can increase 50 to 300%. And I kid you not, because we have MRI data literally of women self-pleasuring, and they're also looking at erotic videos and stuff. MRI information, images showing this real engorgement that's happening. So what do we need to be able to have the functional clitoris and the stimulation that we need to get orgasm? Well, blood flow. We need to make sure that the tissues have enough blood flow so that when you stimulate the nerves, and there is a specific nerve, a branch off the pudendal nerve, and we can even test this, where you touch the clitoris and you'll see a little wink at the anus. That is called the clitoral anal reflex. All of this is intimately involved with sending signals through the nerves to the spinal cord, the dorsal root ganglion, back up to the brain and the pleasure centers of the brain to give you that sense of well-being, and then the physiological things that can happen with orgasm, which are transudative lubrication and excitement that can lead to actual contractions of the muscles surrounding the vagina. And some women will, with orgasm, will actually get a squirt, a little transudative squirt through some of the glands that are around the urethra and in the vagina itself. Sometimes that can come out of the bladder and it's related to urine, and there could be some bigger gushes that way. But the fact of the matter is, you need to have all of this, the anatomy, the nerves and the muscles, and the important neurotransmitters. Some of these are like nitric oxide, vasoactive intestinal peptide, things that cause engorgement and blood flow in order to occur. You also need to have a clitoris that's not covered over or damaged. So that's why I was talking about when you get some of these labiaplasties and some of the things that I fear young girls particularly, and even some postmenopausal women, they want to unhood the clitoris. They want to take off the skin that covers the body. That's really not good because a lot of nerves are coming in that direction. you want to trim up the lips, but then those lips kind of converge at the bottom. That's called the frenulum. So there's a hood, and then there's underneath this little glands, there's a frenulum. When you cut into that area and unroof things, not only can you affect the blood supply to this very important organ, you can also damage the nerves or specific branches of the pudendal nerve. So all of this comes into play, and it makes it a little bit harder when you become menopausal, because things resorb. Estrogen levels make it so that the skin on the outside, as well as the lining of the vagina, really thin out. And that's when Dr. Kingsburg, and I know Dr. Vakar is going to be talking about this next, it's really important that we keep that tissue kind of healthy with some local estrogen. And there are other formulations, and I know we've done several podcasts on this, and Christine will talk about it again, but it's important to keep that healthy and sort of thickened, because you want to maintain that blood flow and that ability to get the engorgement, and hence the transudative lubrication that's necessary to have a pleasurable sexual experience. Now, I mean, orgasm is not the be-all end-all, although it is very nice to have. There's different models of sexual response. There's this linear model, almost like point and shoot, with excitement plateau, orgasm, resolution. And then there's a circular model with just, all of this arousal, desire, everything that comes into a sense of well-being is also really important. I know, Cheryl, you would want me to focus on that circular model of sexual response, but my goal here was to talk about orgasm, so we're going to still talk about it. I don't know, that was a long answer to your question, which was, what do you do when you can't get orgasm? What you do is you go and talk to your doctor, and we take a look at things down there, and we talk about where this clitoris is located, because I can tell you that people may not exactly know, and they may not know how to masturbate. They may not know exactly where to stimulate in order to be able, and it's surprising me. I have patients that have been married, 30, 40, 50 years, and to the same partner. And, yes, now the partner with the 50, 60, 70 rule has erectile dysfunction. So, she's never had, but there's nothing wrong with the fingers. There's nothing wrong with his tongue. There's nothing wrong with getting an enhancement toy to be able to place it on the spot, because, with age, yes, blood flow goes, even your innervation kind of decreases with age. So it's going to take a little bit more stimulation. As Cheryl said, you're going to be a little bit more creative, and, in order to be able to achieve it, but it is totally achievable. And it's definitely bliss when it happens for a lot of people. Now you're going to ask me